In just 4 years, Theranos went from a $700 million valuation to zero. The single lab test claim that sealed its fate was a lie you'll never hear on the news. That collapse didn't just erase a billionaire's fortune. It cost employees their careers, left investors with empty pockets, and jeopardized the health of patients who trusted bogus blood results. You'll hear the same warning signs in any startup you consider backing, and recognizing them could protect your own money and reputation. So how did a promising health tech unicorn tumble so spectacularly? The rise. Elizabeth Holmes founded Theranos in 2003, a garage startup promising to run hundreds of tests from a single finger prick. By 2014, the company claimed its proprietary Edison device could deliver results faster and cheaper than any lab. That promise attracted high-profile board members, former secretaries of state, a former CIA director, and a seasoned venture capitalist. In 2015, Theranos raised $700 million, pushing its valuation to $9 billion. Holmes, at 28, became the youngest self-made female billionaire, flaunting a black turtleneck as her uniform. The warning signs behind the glossy press releases, engineers whispered about software glitches and hardware failures. A 2015 internal memo flagged that the Edison device could reliably run only 12 of the promised 200 tests. Yet the sales team continued to promise the full suite to hospitals and insurers. The company's 10-K filing omitted any mention of the Edison's limitations, and the SEC's routine reviews never raised a flag, because Theranos had built a wall of secrecy around its data. The turning point, in early 2015, journalist John Carreyrou of the Wall Street Journal received a tip from a former Theranos employee. He published an exposé titled, "Theranos says it was a blood test, but it wasn't." The article revealed that most patient samples were sent to third-party labs, not processed on the Edison. The piece also quoted a senior scientist saying, "The technology simply does not work." That same week, a whistleblower filed a complaint with the California Department of Public Health, alleging that Theranos was violating state lab regulations. But it gets worse. Theranos responded with aggressive legal threats, suing the whistleblower and the journalist for defamation. The company's PR machine launched a counter-campaign, emphasizing Holmes's visionary leadership and the potential to democratize healthcare. Investors, dazzled by the narrative, doubled down, pouring another $200 million into the company in late 2015. The collapse in July 2016. The Centers for Medicare and Medicaid Services, CMS, conducted an unannounced inspection of Theranos' Newark lab. Inspectors found serious deficiencies in quality control, leading to a ban on the lab's blood testing operations. Within weeks, Walgreens pulled Theranos' blood testing kiosks from its stores, and the Wall Street Journal released a follow-up story detailing more internal emails that contradicted the company's public claims. By September 2016, the SEC announced a civil fraud investigation. Holmes and former COO Sunny Balwani were subpoenaed. Meanwhile, investors began demanding their money back. The valuation plummeted from $9 billion to under $1 billion, and the board started resigning en masse. That was the easy part. In March 2018, the SEC charged Theranos, Holmes, and Balwani with massive fraud. They settled without admitting wrongdoing, but Holmes was forced to return 18.9 million shares, roughly $500 million at the time. Balwani faced separate criminal charges. In June 2018, a federal judge ordered Theranos to dissolve, liquidating its assets to pay creditors. The aftermath. Holmes faced a criminal trial that began in 2021. In January 2022, she was found guilty on 4 counts of fraud and conspiracy, sentenced to 11 years in prison, and ordered to forfeit $452 million. Balwani received a 20-year sentence. The company's former employees struggled to find work. Many were blacklisted in the biotech industry due to the scandal's notoriety. Investors, including venture capital firm Draper Fisher Jurvetson, wrote off the entire $700 million they had poured into Theranos. But it gets worse. Patients who trusted Theranos' results suffered misdiagnoses. Some were told they had cancer that didn't exist. Others received false, normal readings that delayed treatment. The fallout sparked new regulations requiring startups in health tech to undergo third-party validation before marketing. So what can we take away from Theranos' collapse? Lesson 1. Demand verifiable data, not just bold promises. Holmes's pitch sounded revolutionary, but there was no peer-reviewed research or FDA clearance. If a company can't show real-world performance, treat it as a red flag. Lesson 2. Watch the board composition. A star-studded board can give a false sense of legitimacy. None of Theranos' directors had medical or scientific expertise, yet investors let that slide. Lesson 3. Regulatory oversight is your safety net. When a startup claims to operate in a regulated field, health, finance, aviation, ensure it's compliant with the relevant agencies. The CMS ban was the first public sign that something was seriously wrong. The people behind Theranos didn't set out to deceive. They believed in a vision that outpaced reality. The difference between them and you is awareness, and that's exactly why you're here. If today's story made you rethink how you evaluate high-growth startups, consider a platform that forces you to see real performance metrics before you invest. Webble offers free trades for 90 days and gives you access to detailed SEC filings and analyst reports in one dashboard. It won't protect you from every mistake, but it's a solid starting point. And if you want more breakdowns like this, deep dives into the biggest financial disasters in history, hit subscribe. We publish a new investigation every week, and you won't want to miss the next one. Criminal or just reckless? Tell me below. Save this video so you don't forget the warning signs.